Hello friends, welcome back to your own YouTube channel Ask Your Gynecologist. I am Dr. Sonal Parihar. Today I am back again with a new video. Today's request is twin pregnancy. Complications occurring in twin pregnancy. Now twin pregnancy means you got two babies in your tummy, so it's double trouble. Why double trouble? Because obviously the signs and symptoms, the problems that you normally face in a single pregnancy almost double up in a twin pregnancy. If you have subscribed to my channel, you will obviously know that this particular video has been covered in the previous videos, that what are the common signs and symptoms that a lady who is pregnant will suffer from. If you have not subscribed, then please subscribe to that, right? So, twin pregnancy is it's a blessing for ladies, of course, and generally it is very common in ladies who are between 30 to 40 years of age, or ladies who are undergoing IVF, that is test tube babies, right? But it can happen in any kind of age group and in any particular race or without any other, right? So, if we discuss the twin pregnancy today, I would just like to say that all the hormonal changes that you actually undergo in a single twin pregnancy, they double up. So because of all these hormonal changes, obviously all your problems, they develop. Your headaches increase, your digestion problems because you've got two babies in your tummy, so obviously you've got lots of pressure on your intestines. The hormones are really high, so you have lots of bloating, gastritis, constipation, backache, then some vision problems, then eating problems. So all these problems that we have discussed in the last videos, they will kind of develop. So, if we actually discuss the complications, what kind of complications a twin pregnancy can actually face, then I would like to divide it into two parts: maternal complications and fetal complications. Maternal means what the mother is going to suffer from, and fetal means what the babies are going to suffer from. Now, first of all, I would like to stress that you should actually get an early ultrasound, which I had mentioned in my previous video, that why an ultrasound at 6 weeks is very important. Because at 6 weeks, around about say 1.5 months of pregnancy, you come to know that your baby has a heartbeat, that's a viable pregnancy. We come to know that the baby is at the right position, it's inside the uterus, it is not outside, it is not an ectopic pregnancy. We also come to know whether you have got one single baby or twins or triplets. So this is the right time to get it done. If you have twins, now nature says that normally every ovary releases one ova every month, and that gets fertilized with the sperm from the husband, and that develops into an embryo. Sometimes the ovary can actually release two ova. So if they get fertilized separately with two sperms, then there will be two babies, right? But because they are two different eggs, so the two babies will be non-identical twins. They will have a membrane in between them to separate them. They will have different houses, that's called a sac. They will have different sacs and different placenta. So they will be non-identical, the genetic material will be different, right? So that is called dichorionic diamniotic. Now that makes sense, I hope so. Now, if one particular egg gets fertilized with the sperm, becomes an embryo, and then it divides. It divides into two. Again, this becomes a twin pregnancy. Now, these twins are identical because they are coming from the single egg, and the same zygote has divided into two. Depending upon what stage this embryo has divided, day 3 or day 5 or day 8 or day 13, so that is very complicated for you. But you should just know that identical twins can be of 2-3 types, right? Because they are identical, so obviously they will have same genetic material, they will have same sex. Non-identical twins, because they are dichorionic, they have different sacs. Now they can be of similar sex or they can be of different sex, but identical twins always have same sex, right? Now identical twins are definitely monochorionic, but they can be monochorionic diamniotic or monochorionic monoamniotic, that means in the same sac. They don't have any separating material. So how do we diagnose that? This is diagnosed best at the stage when the pregnancy is around 6 to 7 months, because that is the time when the twin pregnancy can be easily seen, and we see that particular membrane separating the twins, and that's called the lambda sign, right? So it is very important for you to get an early scan. You will obviously be asked to come to the doctor more frequently if you are having a twin pregnancy as compared to a single twin pregnancy. Normally, you will be called for sonography at 6 weeks, that is the early scan, then 12 weeks for the NT scan, then 5th month again, that the 20 weeks anomaly scan, which we had discussed, to detect any birth defects, any anatomical problems in the baby, and then again in the 9th month if required. In the twin pregnancy, after the 5th month, after the anomaly scan, you will be called every month for a sonography just to check the growth of the babies. Because, of course, there are two babies, they are kind of competing with each other in the same uterus, getting the same blood supply from a single mother. So, obviously, the growth has to be monitored properly so that early delivery, if required, can be done. Right? Then coming to the complications. The complications, if we divide it into, as I said, maternal and fetal, coming to the maternal complications. Now, the maternal complications, as I said initially, all the problems, the symptoms, the signs and symptoms that a mother faces during pregnancy are going to develop. They are all going to develop because of the excessive hormones. Now, the nausea, the vomiting, the headaches, the blurring of vision, the backache, the constipation, the gastritis, everything is going to develop, right? Second complication would be gestational diabetes. Now, pregnancy itself is a diabetogenic condition which we have already discussed in the previous video, right? So, obviously, if you have two babies inside you, then the hormonal changes are such that you are more prone to gestational diabetes as compared to a single pregnancy. And this can be easily diagnosed with a simple diagnosis, right? Now, this gestational diabetes might persist even after delivery in some cases, and it might develop into diabetes mellitus too. Okay. The third complication can be preeclampsia. Preeclampsia is a very dangerous condition in which the blood pressure of the mother rises and the blood supply to the babies, which goes through the placenta, gets hampered. Because the blood vessels, the capillaries which are crossing the placenta, they get stenosed. Because of high blood pressure, the blood supply doesn't go properly to the fetuses. So obviously the growth of the babies, it gets retarded, and the patient, the mother might have fits. And in that case, we have to deliver the babies immediately. So it is life-threatening to the mother as well as the babies. Right? Coming to the fourth complication. Fourth complication that we should know is premature rupture of membranes. The premature rupture of membranes and preterm labor. Preterm labor means you're having delivery before the 9th month. Before the 9th month is complete. These two go hand in hand. This is because there's so much pressure in the uterus, so much pressure on the cervix, that is the mouth of the uterus and the membranes, that sometimes the twin delivery happens just about say 34 weeks, as soon as the 8th month is complete. Almost 60% of the twin deliveries, they happen at around 34 weeks. It's very common. But I tell you, if it happens after or around 34 weeks, it is quite safe. Because 34 weeks means around 8 months, just about the 8 months is complete. So that is the time when we actually expect the babies to be mature enough to come out and start breathing. Their lungs are mature enough. So it's not very life-threatening, right? But if it happens before that, then of course, then we have to take care of the babies and put them in the nurse form. Okay, so premature rupture of membranes and preterm labor is quite common. Another complication that can happen with the twin pregnancy is miscarriage. Now, the miscarriage rate as quoted by the book is 1 out of 500 in twin pregnancy. It's almost double the rate of a single twin pregnancy because of obvious reasons which we have already discussed, right? Then coming to the next complication that you should know is abruption placenta. Abruption placenta means the placenta which kind of covers a major chunk of the uterine wall and connects the mother and the baby suddenly detaches from the uterus. If it detaches, the mother suddenly feels some pain, some bleeding, the blood pressure might shoot up, and the baby is at risk because the blood supply from the mother to the baby gets cut off. As soon as it gets cut off, the baby has to be delivered immediately because then it has no other way to survive. So within minutes, within say half an hour, I should say, depending upon how much blood supply has been cut off, how much of separation of the placenta has occurred, the baby has to be delivered. So that's called abruption placenta, right? Coming to the next complication, cesarean delivery. Cesarean delivery rate is more in a twin pregnancy as compared to a single twin pregnancy because obviously in a twin pregnancy there are two babies, so the presentation of the babies might differ. It might be one might be cephalic, that is in the right position, head down, the other might be breech, or both might be breech, or both might be head down but difficult to deliver because their heads are getting kind of entangled with each other. This is very common in monoamniotic twins when the sac is the same and the babies are in the same sac in the same house, and then they kind of, when they come down, their heads get entangled or the cords get entangled. Now these are the complications, the fetal complications, which I'm going to discuss later. So, cesarean delivery, you should know, is very common in twin pregnancies. Normally, if the first twin is cephalic, that means it is coming head down, then we can give it a normal trial. The first baby can come out normally. Second baby, depending if it turns after the delivery of the first one, it can be delivered either head down or even breech. Even through legs, it can be pulled out because the weight of the twin babies is less than the single babies, right? The single babies, if they are around 2.5 to 3.5 kgs, these twin babies are not more than 2.2 or 2.3. Sometimes maybe 2.5. If they are really healthy, then 3 kgs, very rare. So we can give it a try to deliver the second baby by breech. Okay, it all depends upon your condition, the maternal condition, and of course the doctor's expertise and doctor's decision. But cesarean is more common in twin pregnancies. After delivery, the next complication is PPH. Now, I have a separate video. If you have not subscribed, you can always subscribe. Just scroll back, and a couple of weeks back, I have already uploaded this video. PPH, that is postpartum hemorrhage, which means excessive bleeding after delivery. Now, because of excessive distension of the uterus, it takes time to kind of contract again for the blood vessels to get crushed with the muscles. So it takes really a good amount of time to actually stop the bleeding in a twin pregnancy, and we have to prepare. We have to be prepared for that. We have drugs, we have medicines which should be kept there for a twin pregnancy. As soon as they deliver, they need these drugs so that the bleeding stops. So PPH is quite common in twin pregnancy, right? Coming to the fetal complications, the complications that the babies can suffer from. First of all, the babies are LBW, low birth weight. Obviously, a single pregnancy, as I said, might be around 3 kgs, that's an average weight. But for a twin pregnancy to attain that much weight is very difficult because they're kind of competing within the same uterus, within the same mother, with the same blood supply. So obviously their weight is lesser. There might be some difference in the weight of the two twins. Sometimes the first twin is larger than the second one, or it can be the vice versa. Around 200 to 300 grams difference might be there. So such growth retarded babies, they need proper surveillance. Why? Because they might suffer from hearing problems, they might have vision problems, like eyesight might be weak, they might have some delayed milestones, they may not develop, their mental development may not be as good as the other babies, like they may have cerebral palsy or mental retardation. So these low birth weight babies, which are called the growth retarded babies, they really need good surveillance, right? Come to the next complication. Now, we have already discussed in my last videos that birth defects are normally diagnosed at the 5th month when you do an anomaly scan. So an anomaly scan is a must for such twin pregnancies because birth defects are very common in twin pregnancies. What kind of birth defects can we expect? Well, it can be something in the brain, like development of the spinal cord, skeletal deformities. Then there might be some problem with the abdomen where the intestines lie. Now the intestinal problems might be that sometimes the intestinal covering might not be there, like the stomach and the skin covering of the intestines that might be missing, which is called omphalocele, gastroschisis, that it might be present in the sac. So these are certain kind of abnormalities commonly seen in twin pregnancies, and some of them can be corrected, some of them may need an abortion because they may not be compatible with life, some of them might need an immediate surgery as soon as the baby is out. So you really need to make sure that you get an anomaly scan in a twin pregnancy. Even if you miss out in a singleton pregnancy, please do not miss it out in a twin pregnancy. Okay. Coming to the next complication, it's a very distressing condition, very distressing time when the patient is told by the doctor that one of your twin has expired, has died inside the uterus. Now, what do you do then? If the twins are in different sacs, they have a different house, the amniotic sac is different, then you need not worry. Because by nature, if one twin has died, the other twin is not going to get aborted. If the nature doesn't want the pregnancy to continue, it will abort it automatically. You don't need to do anything. But if one particular twin has died and the other twin is healthy, hale and hearty, do not go for abortion. Because the twin that had died, it will naturally get absorbed, and the twin which is growing healthily, it can easily deliver it. Right? So let your doctor decide what to do, and if the sacs are different, you need not worry about it. So that is why we do more frequent sonographies in twin pregnancies as compared to single twin pregnancies. Right? Coming to the fourth complication is cord entanglement. Now, cord entanglement, as I said, when the twins are in the same sac, when they are monoamniotic, when they are kind of playing around in the uterus and turning and twirling, at that time the umbilical cords can get entangled. In that case, the blood supply to one particular twin or both the twins can get hampered and can be life-threatening. Right? So that is why we do more frequent sonographies and we keep a check on the fetal movements as well, that the baby is moving inside the properly, both the twins. Right? Come to the last complication, which again is common and actually seen generally in monoamniotic twins, but it can be in diamniotic as well. But the placenta has to be common with it. It has to be a monochorionic pregnancy, right? And it is very rare, but it is very surprising that these things can happen in nature as well. So it is TTTS, that is twin to twin transfusion syndrome. What does that mean? That means that the blood supplies, the capillaries and the blood vessels supplying to both the twins are kind of getting mixed in the placenta. So they kind of entangled in the placenta, and one twin starts supplying blood to the other one. So one becomes a donor, the other one becomes a recipient. So the donor becomes very thin because all the blood supply that it is getting from the mother is getting diverted to the other twin. And the other twin, which is receiving so much blood from the other twin and from the mother as well, becomes plethoric, becomes fat, becomes really hydropic. So it is difficult for both of them to survive. So one particular sac, one baby is going to become so shrink, it is going to shrink very badly, and the other one is going to become very plethoric with a big sac, lots of fluid. This one will have hardly any fluid. So this is a syndrome which can be diagnosed very easily by ultrasound, and in some centers it is very easily diagnosed by ultrasound. It can be easily clipped as well. The laser treatment of such particular connections, the abnormal connections of the blood vessels, can be stopped there and then. Of course, there are only few centers where we can do it, but the diagnosis has to be made at the right time so that we can save both the babies, right? So I think this is all you need to know about twin pregnancy. I would just say, just take care of yourself. If you know you are having a twin pregnancy, do visit your doctor more regularly. Do listen to her and be aware of the complications, be aware of your weight gains and the common problems that you might suffer from, and be aware of the birth defects that can happen in twin pregnancy, right? So take care. If you have any questions, you can always inbox me in my YouTube channel. Do subscribe to my channel, Ask Your Gynecologist, and you can also follow me on my Instagram handle, sonal.parihar.30. Till then, take care. I'll be back again with a new video. Bye for now.